Hey guys, this is a big topic, pardon the pun. The obesity crisis in the UK, and I don't mean those words lightly. Obesity is a major issue in the UK. In fact, many people are calling it an epidemic. And I have seen questions come up both in medical and dental interview circuits already, and I can only imagine this question or that these type of questions will float around for a number of years until we get to any point in addressing this issue in the UK, which I think at the moment it's fair to say we're failing at miserably, I'm afraid. Although I'll discuss further about how the UK and in healthcare we're trying to do our best to address this. So why is it an epidemic? Well, I think it's fair to call it an epidemic because in the UK, we're in the top 10 around the developed nations in the G20. We're in the top 10. I think we're only about behind the US in terms of overall obesity rates. And it's impacting on people in so many different ways. And no doubt it's going to impact on you as a medic and as a dentist in the future in a massive way. Let's have a look at this. There is an estimate of something like 6 billion the cost to the UK economy and to the NHS in terms of addressing people's obesity-related health problems. Remember, this isn't just about somebody who's obese and what needs, say, an injection or something to help them lose weight. When you've got obesity issues, it's affecting people's quality of life. It's affecting their life expectancy. It's affecting their cardiovascular health. It's affecting their joints, it's affecting their lungs. So really obesity affects people in a multifactorial way. What's driving the epidemic? Well, it's important you reflect on it and kind of understand the key concepts around that. Well, I think a few that we can look at here is dietary habits. Over the years, what we find is that people are eating a lot more than they need to. As you know, diet is essentially it's calories. How many calories do you need in a given day? And that very much depends on whether you're a man or whether you're a woman, how active you are in your job and in your lifestyle. And it's very important to note that nowadays we're probably a lot more sedentary in our work life compared to our forefathers, say half a century ago, a century ago, where they were plowing fields, where they were doing a lot more manual labor and so forth. So they probably needed a lot more of a bigger diet and a high calorie diet at that. We are probably a bit more inactive as well nowadays. I'm sure you'd agree. Our forefathers were walking everywhere. They didn't have access to cars and transport as easily as we do. They probably did a lot more physical work day to day when they got home in terms of washing their clothes, preparing food, cleaning the house, building houses, maintaining houses, acquiring their food. They probably had to do a lot more physically in that sense. If you look at socioeconomics as well, that plays a big part in that we do see obesity at high rates among the more deprived sections of our community. And why is that? What are the factors driving that? And there's many. Marketing is a massive thing as well, I find, in that if you look at advertising these days, we're very much led by advertisement campaigns. So if you look at what's perceived as healthy and what's been advertised on the TV as healthy, if you like, whether it's those yogurts, whether it's those fruit juices, whether it's variety of things that I come across on TV. And if you analyze it, you actually find that they're not any healthier than the perceived unhealthy food. And in many cases these days, we're finding that they're actually more unhealthy. And for example, the low-fat yogurts laden with high amounts of sugars. We're finding that sugar content is actually, potentially worse for you than fat content. Evidence is building up in that sense, and who knows what we'll see in terms of guidelines that's coming towards us for healthcare clinicians in regards to fat intake as opposed to sugar intake. But that remains to be seen. But there's no doubt in my mind, that plays a big part. Genetics is a big thing as well, and biological factors. So, we're living in a world where people are a lot more mobile. So if you look at my ancestry from the Indian subcontinent, over there, there was a time when it probably suited people to be centrally obese, i.e. having fat around the central areas of the body. However, parachute a certain population from there into the UK, US, and Europe, and so forth. You don't need those genetic advantages that you had for that environment in the Indian subcontinent. And the same goes for people from other, whether it's Southeast Asia, whether it's from Africa, Middle East, from the Far East, and so forth. People are moving around a lot more, and that also affects obesity rates as well, with dietary habits and so forth, and access to certain types of food. We're trying. I think individuals, healthcare, teaching, government, in all aspects of stakeholding, from the government, there is an effort I can see and we can see to try and reduce this obesity epidemic. If you look at government policies, for example, we had the sugar tax, if you remember, a few years back. How is that impacting on reducing obesity? The introduction of calorie labelling in restaurants, that's becoming more popular, and I think it's going to come into legislation soon. You've also got the restrictions on certain ingredients within food, and also there are restrictions that are coming in more and more in terms of advertising around junk food and certain types of food products. Within healthcare, I mentioned injections. Well, Manjaro, Ozempic, there's probably going to be others by the time you see this video. There's a lot more of an emphasis on lifestyle medicine. So the emphasis on prevention, keeping people healthy, that's a big thing in primary care, in dentistry, and in secondary care as well. Interventions on the other end as well, bariatric surgery and so forth in secondary care is it's a lot more available than it used to be 10 years ago, and I presume there's going to be more newer approaches in that kind of intervention as well. In the community, I've seen this uptick around encouraging activity, having facilities being available for free or at discounted costs, or more community activities going on, such as park runs, for example, swimming pools being open, being more accessible for certain minority communities, i.e. women-only sessions, men-only sessions. There's other initiatives going on in the community, like competitions, and community forums, WhatsApp groups, things like that, using digital and tech to aid that. And also the, increase in access to affordable and healthy food. Even though we've seen inflation make a big dent against that, we're also seeing that, yes, there is a bit more emphasis around access. So supermarkets are making an effort there as well in educating and making healthy food more accessible for people. In schools, colleges, universities, through media, we're seeing an increase in emphasis on eating healthy and healthy lifestyle, cooking classes, nutrition, and so forth. I'm involved in public health initiative in my local area to educate children when they're young, educating them at school with cooking classes, with access to food and the type of food, and also how much one should be active, throughout the life. There's a big emphasis on delivering that education, if you like, to communities. So it's no surprise at all, so a few questions that I've already come across in medical and dental school interviews, like, for example, what do you think are the main causes of obesity in the UK? How does obesity impact on, dental care? How does obesity impact on gum health? How can you tackle obesity as, within your capacity as a public health official? What about the sugar tax? I've seen that a few times, actually. How has that affected oral health? How has that affected people's dietary habits? And what impact does this have on people's cardiovascular disease rates? What role should a doctor or a dentist play in addressing obesity? Is it important that they play a role in tackling obesity? Is obesity a disease? That's an interesting question. Why would you consider it to be a disease? And why would you not consider it to be a disease? So I've seen those questions, and I'm going to see more of them, I'm sure. So that's certainly a topic to think about.